A criminal investigation is underway after hundreds of tons of medical waste, including body parts, were left to pile up at several sites in the UK. Healthcare Environmental Services has a contract for disposing of much of the hospital waste from England and Scotland. The government has been urged to explain why it didn't tell Parliament it had convened the Cobra Emergency Committee last month to discuss the problems. Here's our health editor, Hugh Pym.
One of the main sites at the centre of this medical waste saga, at Normanton in West Yorkshire. The company allowed a backlog of waste to build up at centres in England which should have been sent for incineration. The regulator, the Environment Agency, told the government in July. Ministers discussed it at a meeting of the Cobra Emergency Committee last month, but it was only revealed yesterday. And the local MP, Yvette Cooper, told me MPs should have been informed sooner.
Well, I think it's irresponsible that the Health Department and the Environment Agency still haven't told us the full facts about what on earth is going on an issue where there are environmental health questions being raised and we still don't know the full facts. It's completely unfair on the local community.
The other main site is at Shotts in Lanarkshire. The company, Healthcare Environmental Services, is run from here. A new facility was opened only in April by Princess Anne. The managing director, Gary Pettigrew, said he would continue to work with different agencies till the issue was resolved. The company says there's a lack of incinerator capacity to burn the clinical waste and claimed tonight in a statement that the amount of waste produced by the NHS for burning outweighs the entire incineration capacity in the UK. Not so, says the Environment Agency.
We've looked across the country, worked with other healthcare sector waste operators. We know there is no capacity issue with incineration across the country to deal with clinical waste.
Industry experts agree, but say the cost of incineration is rising.
We've still got the same number of incinerators, we've still got the same, more or less the same amount of waste going through them. But what has changed is the market price for that capacity. It fluctuates a lot over the years, but over the recent 12-18 months, the price has increased quite considerably.
The Department of Health and Social Care covering England said in a statement, "We are monitoring the situation closely and have made sure that public services, including NHS trusts, have contingency plans in place. There is absolutely no risk to the health of patients or the wider public." The Environment Agency said as part of its enforcement action, it had partially suspended the company's permit here at the Normanton site. That means it won't be able to receive any more hospital waste for incineration while it concentrates on trying to reduce the backlog. With the regulator taking action, it's not clear what this will mean for the company's future and the ability of the NHS to dispose of its medical waste. Hugh Pym, BBC News, West Yorkshire.
Now, the clinical waste disposal company at the centre of controversy for allowing medical waste to pile up at its plants has lost several of its contracts in England. The government says it first became aware of concerns about healthcare environmental services in July, but claims that there was never a risk to public health. The work has been taken over by another firm.
The head of the company at the centre of the controversy about stockpiled medical waste has hit back against claims of mismanagement. Speaking for the first time, Gary Pettigrew of Healthcare Environmental Services told the BBC that body parts were not stored any longer than they should have been. The company has been stripped of some NHS contracts after hundreds of tonnes of clinical waste piled up at its sites. Mr Pettigrew was speaking to our health editor, Hugh Pym.
He's the boss at the centre of a national row over hospital waste. Gary Pettigrew's company has lost disposal contracts with some hospitals in England because he was storing too much waste at his sites. But he claimed to me in some cases medical waste was now not being handled safely.
I know just now that waste is being stored in hospitals in shipping containers, and shipping containers are being lined with black liners to stop the stop of liquids, whatever else, coming out of this that's been put into skips.
The Department of Health denied this and said there was strong governance to ensure safe disposal of waste and no gap in service provision. Mr Pettigrew says his company had a backlog of medical waste because of a lack of incinerators around the UK to burn it. In a statement today, the regulator, the Environment Agency, said it's not true to say there's insufficient incinerator capacity. Healthcare Environmental Services has significantly and repeatedly breached its permits by storing excess waste. In email seen by the BBC, Mr Pettigrew wrote to the agency in May advising, "We're chasing every bit of available capacity as and when it becomes available." An official responded, "I am aware of the unprecedented challenges we have with hazardous waste incinerators at this moment in time." The agency said today planned shutdowns did sometimes occur for maintenance. The company says it's been vilified for providing an excellent service. What do you say to some who've said there are body parts being stored at your sites and it's unhygienic and it's not safe?
None of that is true. Every single part that people are referring to there is dealt with securely, professionally, and again, any anatomical waste would be stored in fridges and at the same time prioritised for outward bound.
In response to allegations from former staff that there'd been a range of practices at sites which might be worrying to the public, the boss said they operated in line with official permits. Hugh Pym, BBC News.
Patisserie